Greetings and salutations to all you fine people out there. Wanted to put this up to just walk you guys through really quickly. Just a treatment and rehab assignment. The template's done. It's up on Moodle. So that is there for you. And I've also added quite a bit of things to Moodle that are relative to the assignment. And I want to take a minute to walk you guys through everything. Let's talk about the assignment. Let's go through the template. Let me walk you through it. That way everything is fully explained. That way, hopefully I'm kind of neutralizing any questions or concerns. So let's do it. Okay. Okay, I think you guys can see this at this point. I think I was frozen momentarily, but now I'm unfrozen. Just had to let it go. So, okay, the rehab and treatment plan assignment template. Okay, it's up. Okay, it's here. So ultimately what I've done, if you look at the template, is I've laid out instructions for you, okay? Step by step, I tell you what I want, okay? And just like with the clinical documentation and diagnosis assignment, right? The template's laid out exactly like, basically, I want you to complete the assignment. It's all here. So ultimately, there's this assignment though requires a little bit more critical thinking. And a little bit more, maybe a little bit more thoughtfulness. It's essentially maybe not as mechanical as the clinical diagnosis and documentation assignment. Excuse me. So we're really looking for a little bit more in regards to, obviously patient-centered care, right? And looking at things like, clinician rated outcome measures and patient rated outcome measures. I will explain those, so don't freak out. You've probably heard about those a little bit before, but we're going to talk about them, and I'm going to explain to you what they are and how to use them in this assignment. Okay, so obviously, so number one, evidence of a patient-centered discussion or decision based on discussing treatment options with the patient. Number two, you've got to provide a serial history and evaluation as a part of your treatment plan. I know it obviously seems like a lot, but I promise you, any good treatment plan, every time you see the patient, you should be assessing them, period, right? So now, in the template that I'm giving you guys here, pay attention though to the content of the exam. How is it different? Take a look at it, right? And try to identify exactly what about the exam is different here than what it was in the clinical documentation and diagnosis assignment, right? So you'll be expected to express both the clinician oriented outcome measures that you're going to be looking at. So what is that? What is a clinician oriented outcome measure? Okay, when you see a patient, okay, you have a goal of making them, obviously you want them to be better, right? And how do you, as a clinician, how do you conceptualize that? You're like, well, if I'm treating a patient, I want them to, by the time I'm done seeing them, if they have range of motion and strength deficits, I want them to have more range of motion, so increased range of motion. I want them to have, 5 out of 5 strength in, these given planes, right? I want increased functional capacity, so on and so forth, right? Those are clinician-oriented outcome measures. That is what I am looking for this patient. Okay, that is how I would define success for them. That's how I say, okay, you're better because you've met these criteria. But there's a bit of an issue there. Okay, I'm not the patient, so the patient has to be able to look at me, right? Well, yeah, has to essentially be able to have a voice in their treatment plan. Okay, and we allow them to have a voice that we can measure by utilization of what's called a patient-rated outcome measure. All right, so a patient-rated outcome measure has been, there's quite a few of them that have been developed, and there are different forms that can be used and filled out by the patient for them to be able to express to you their level of function and their level of impairment, right? And a lot of these have been validated in the literature as well. So let's talk about that for a second. Okay, so when I say, and let's scroll down here. So when I say clinician rated outcome measure, here it is. So what I'm looking for a pain level, okay, looking for range of motion, okay, strength, and their reported level of function, okay, and or what they tell me are their functional impairments. All right, so those are my goals. The patient oriented outcomes though, okay, we're going to use a SANE score. What in the world is a SANE score? I'll explain it. Okay. And then we're going to also use an outcome measure known as the International Knee Documentation Committee, or IKDC outcome measure, to be completed actually. And let me change. That'll be changed actually. Should be initially at 2 weeks, and then at the end of the treatment session at 1 month. So I'll adjust that. So anyway, okay, let me give you guys a little bit of a kind of a primer here on that. Okay, so the SANE score. All right, the SANE score. Actually, sorry, scroll back down here. Aha. Okay, so the SANE score stands for, okay, single. All right. Oops. Sorry, guys, 1 second. Got turned around. Okay, so a SANE score stands for a single assessment numeric evaluation. Okay, SANE score. This is actually really easy to obtain. So the way that I typically do this in practice is I'll ask a patient, okay, so if you could give your shoulder or your elbow or your wrist or hand, right, a score, like a test grade on a scale of 0 to 100, 0 being a complete failure, 100 being perfect, where would you rate yourself today? So in this example, okay, Marie, our patient, gives her knee, okay, a SANE score of 60 out of 100. All right, so that's one outcome measure. That's one patient-oriented outcome measure that she provides. All right, and so if we scroll back down here, I have expressed a goal here, though, that I want to have an improvement in her SANE score of 85 out of 100 within a month. Why 1 month here? Because that is how long the Athletic Training Practice Act in Minnesota allows us to see a patient prior to referral to a physician. Okay. Anyway, but yeah, so that's based on at least the law in Minnesota. So obviously, also we want her IKDC scores to improve from where they are currently to 65 out of 100 within 1 month. Okay, so let's talk about kind of some examples of patient-oriented outcome measures for the shoulder. So we'll go back to Moodle here. Okay, let me stop sharing. And now I will share the magical land of Moodle with you guys and show you exactly what I'm talking about. All right, Moodle, here we are. Okay, check me out. So what I have, okay, this is an option that you can utilize, okay? And what I'm essentially wanting you to do here is you can actually go through and, set your, basically take your patient through this and essentially score them, okay? So here's the dash, all right? So this is the disabilities of the arm, shoulder, and hand, a very kind of generalized blanket score. All right. And so I've posted this for you because, as you can see, the patient's going to scroll through this form, or they would scroll through this form. Let's say you're seeing them for the first time and you're wanting to collect data on exactly what they're describing as their impairments. Okay. So they're going to go through this form and they're going to tell you everything from 1 to 5. They're going to rank it. Opening a jar. They have severe difficulty, right? So they're going to score that a 4. Writing, mild difficulty, only a 2. Right? Turning a key, so on and so forth. Okay. And that will give us a score down here at the bottom. All right. And there's also there's also instructions posted about how to score this. All right. So this is here. Now, really, really cool thing, really cool link, by the way. Let's go back to Moodle. You can actually do this online. I've supplied a website for you guys. Okay. orthopedicscores.com. So we'll click this. Here's the cool thing about orthopedic scores. So we're going to scroll down. We're going to find the dash. Okay, it's got it divided up by body region for us. All right, there's the shoulder. So we're going to use the dash, not the quick dash, but the dash. Okay. So as we get more comfortable, you can branch out potentially, but here's the dash. So check it out. I can go in and I can actually select this. Okay, go through the exact same thing and do this electronically. Okay, when I get down to the bottom, what it's going to do is it's actually going to give me a score down here. It's going to calculate it for me. Pretty freaking cool. All right, it's a time saver, but this is something that I want you guys to do as a part of this project, right? And do this, calculate a score, and you can actually, turn in, like a PDF or something of this along with the project. All right. So there you go. Okay, so I would use a SANE score, but then I would also pick, the DASH. There's another one that I posted as well, for overhead athletes, developed by athletic trainers, people that I learned from at AT Still when I was working on my doctorate. Yeah, this is called the FAST, the Functional Arm Scale for Throwers. There we are. Okay, we can do the exact same thing here. Okay, let's say we're a pitcher. Okay, we can go down and we can fill this guy out. Okay, just like this. And very specific instructions, actually. If you're a pitcher, okay, there's actually a pitcher specific section of this outcome measure. So you'll go over here and you'll highlight this, highlight the box that says that you are a pitcher. All right, right there. Whoop, yes, I'm a pitcher. JK, there it is. Okay, yes, I'm a pitcher. So then we'll go down and we'll complete the pitcher module as well. All right, and then ultimately it will score that for you, and then you can download a PDF or what have you, right, and attach that to your assignment. Okay, ultimately what the reason for this, guys, is that when you guys are out practicing, this is actually going to be expected of you, particularly if you're working for a larger health organization, right? You're going to be expected to track your outcomes. And honestly, it is no longer good enough to say, as an athletic trainer, they've got their range of motion is better, their strength is better, so from my perspective, they're better and they should be better. But if the patient looks back at you and says, wait a minute, I know what you're saying, but I still feel the same. My impairments haven't changed, right? And that's part of the international the disability models that we've been introduced to. And I think you guys have even maybe talked about that, some of modalities as well. Excuse me. So really important to bring these things into the picture, because here's the deal. What if, okay, you are called into maybe a court of law, right? Or you're questioned by, a family member of the patient who says, okay, so, you've done these things and this person has better range of motion, better strength, they're better, right? But what other objective tools do you have to kind of gauge the patient's improvement? You can pull out a patient rated outcome measure and say, okay, it's a great question, mom, dad, sir, ma'am. Okay, here is exactly how we measured that throughout the course of the treatment. And these are the answers that the patient gave, that your son, your daughter, so on and so forth gave during our treatment. Here's what they said. And then you can go over those things, right? So really important, because we're taking the patient's obviously attitude and beliefs into account. And also having another piece of data as a part of our treatment plan to be able to display if needed. So really important, really, really important. Okay, so there you go. Okay, so I'll expect you guys to identify those as a part of the template, and that's listed here. Okay, okay, and let's just kind of walk through this a little bit more together. So, okay, here we go. So what I did, the first thing out of the gate is you can see that I wrote a plan of care here. Okay, so I've picked up right after where I left off with my assessment from my clinical documentation and diagnosis assignment. Now it's time to talk about plan of care. Okay, and in this example, we've done that, right? And now here's the thing. You can see that we have specific language in the plan that details that we've made a patient-centered decision. Sorry. So it says, all right, after discussing treatment options, including surgery and cortisone injections, she states that she is looking for an option that will keep her active, even if her pain does not completely resolve. Okay, the patient has just expressed essentially their desire or their goal for treatment, right? So, given these patient preferences, Marie and I have decided on a course of rehabilitation for her. She can also take 650 milligrams of Tylenol as needed for pain. So there you go. That is how we know, and we've documented that we've made a patient-centered decision and made a shared decision with the patient. Okay, then we move on to our therapeutic intervention note. This is where we actually start treating them. Okay, we have a very brief history based on our previous assignment. Okay, this is just a short summary of what we already know. Okay, now you'll see here that I also threw in a SANE score. Okay, Marie gave me an outcome measure right away, and that was a one question thing. Marie, if you could give your knee, a score today on a scale of 0 to 100, where would it be? Well, it's about a 60 today. Okay, so then I go into a brief exam. Pay very close attention though, guys, to how the exam is different here than it was in the clinical documentation and diagnosis assignment. The content and the goals are different. Pay attention to that, okay? Because here I'm looking actually at different things, and we're going to see if you guys can identify that, okay? Outcomes, we've talked about that. Okay, this is where I list my interventions. Okay, so I'm going to do that. I'm going to list the exercise sets and reps. Okay, there you go. Okay, now goals for the rehabilitative plan. I've listed short-term goals and long-term goals. Now, once again, we've already talked about this. We know that by the Minnesota State Practice Act, as listed on my protocol form as an athletic trainer, I've got 1 month. Okay, 1 month to see a patient before I have to refer them, particularly if they're not better. All right, so you can see that I set the range for my short-term goals as to, for those improvements to be made within 1 month. Long-term goals, obviously, outside of that 1 month time frame, I wanted to have an improvement in sleep patterns because we know previously from the example that she was waking up at night, the pain was waking her up, right? We wanted to be able to climb stairs reciprocally, so 1 foot after the other. She needs to be able to walk 1 to 2 miles without stopping. So that's the goal long term. So obviously more than 1 month out. Assuming that she continued the plan of care that we put in place, right, and continued to progress as well. Then the other thing that I also documented here is that I want her IKDC score to improve to a 50 out of 100 or better. And I'll accept that as success, right? And so those are my long-term goals. And so we would be able to follow that in the event that we're past that 1 month time frame and we're continuing to see the patient and they're improving. We would be able to obviously follow that a little further. And then I've provided my rationale, as you can see, for what treatment I gave and why, right? My exercises, okay? And that's all listed here for you. So there it is. There's the assignment, okay? So yeah, a little bit more thought potentially going into this than into the first one. But remember, you're just picking up where you left off with your previous scenario, and you're telling me about your treatment plan, and everything that you need to do is listed in this gray box. All right. If you have questions, please let me know. Okay, this will not be due until 1 week from Friday at 11:59 p.m. So you guys have time to really think about this and put in good work. All right. Keep up the good work. All right. Thanks, guys. Let me know if you have questions.